Well, good day, Brock, and I'm Ruth Bowie, and I want to thank Shaw Cable on this first Spotlight program, and sponsors of good health for the 55 plus around Kenora area. So today, as I say, I'm happy to welcome you, Brock, as my guest, and you are the manager of Rehab and in the Physiotherapy department here at our Lake of the Woods District Hospital. Now, I want you to describe some, and I will ask you questions to describe some of the benefits of physiotherapy. I know I've had some myself, and it's been very beneficial, but I would like everybody, not only 55 plus, but anybody that's going to listen to this show to know how beneficial physiotherapy can be. And it is going to make for a most informed and spotlight session when it's on TV, on Channel 10. So now I've got one question right to lead off on, and I'd like you to tell me, how can physiotherapists help seniors in our community? And there's many seniors now in our community, as you know.
Yes. Okay. Well, that's a great question, Ruth, and a very timely one. May is National Physiotherapy Month, and it's a time for physiotherapists to share with the public what it is that we do to help people with their pain and their dysfunction. Mm-hmm. So physiotherapists are excellent healthcare partners for seniors, as they have the training, skills, and knowledge to help seniors with a variety of their healthcare needs. For instance, physiotherapists are particularly skilled at assessing and assisting with function, including joint range of motion, muscular strength, cardiovascular fitness, and just general mobility.
Okay. Well, I'm looking around the room that we're taping this in, and there seems to be a lot of equipment here. Is that coming up later, or should I ask you about this now?
You can ask me anytime.
Oh, okay, because I didn't know if it was going to some of the questions I'm going to ask you. But just for example, what are now there's three things here. One looks different from these two, but basically are the same.
So what you're looking at there is three of our treadmills. So we're in the gym at the Rehab department at the hospital, and this is where we offer, for instance, our cardiac rehab. So in the gym, we've got a variety of general strengthening as well as cardiovascular equipment. And as you mentioned, right now we're surrounded by, we've got our new steps, which are a recumbent bike. We have treadmills. We do have two recumbent bikes as well as some upright bikes. Yes, those are our sit-down bikes as well as upright bikes. We have a large variety of equipment that we use as part of our classes or individual therapy.
And are you very busy at any time? You can see all these machines going with patients coming in?
We're very busy right now, yes. Yeah. So we offer a lot of classes between cardiac rehab and some of our other classes that we offer, yes.
So it's nice to know this is here. This is the first time I've ever been here and seen this myself. I didn't know the hospital had so many, you know, state-of-the-art equipment for something like this. I'm very pleased, I must say. So now I'm going to go on and ask you, like, who does provide physiotherapy services in our community? Are you all alone here in the whole town?
No, actually, there are a variety of physiotherapy providers in our community, and it really depends on what your healthcare needs are. For instance, the Local Health Integration Network Home and Community Care program provides physiotherapy for seniors who are unable to get out of their home to access physiotherapy, for instance, at the hospital here.
Well, let me just interrupt then about that, because that's kind of interesting. So you actually have physiotherapists in Kenora that will go to people's homes and have them on their bed or a sofa or something and teach them the exercises that they should do?
Yeah, absolutely, through the home care program.
Oh, okay.
And the physio will go to their homes and will assess them and then set up a program that they're able to do in their homes to strengthen and improve their function.
Now, is that a free thing from the government, or would I have to pay if someone came to my home? And is it very mild? How does that work? Because maybe some seniors couldn't afford it if it's...
No, if you're an Ontario resident, it would be provided through the home care program.
Oh, okay. At all times, and no questions asked, like, can you afford it or not?
As long as you meet the criteria.
Oh, there is a criteria.
And the criteria is that you're unable to get out of your home to access other services.
Which you would have to pay for. Well, you don't have to pay when you come here with the doctors.
No, you don't. This is an OHIP clinic, yes.
Oh, okay. Yeah. Well, let's move on then. Where is the Kenora Physiotherapy and Sports Injury Center located?
So they're located on the second floor of the Kenora Recreation Center. And they're a private non-OHIP clinic. And they help people recover from injury and stay fit and healthy so they can continue their active participation in work and the community and with their recreation.
So if they're a baseball fan or player in the summer, they could probably play baseball, or can they play hockey, or is it?
They could actually, yeah, if anybody's injured, they could absolutely go to the sports center for...
Sports, so that's what it says, sports, so that's exactly what they mean.
Yeah. Well, they do everything, for everything from motor vehicle accident to any injury, but certainly they do have a special interest in sports, yes. Okay,
well, that's very interesting too. Now let's go right here to our own Lake of the Woods District Hospital Rehab Department. Now, who does it just people that's in the hospital have had a stroke that can take advantage of this, or how does this work? Like, I had a doctor refer me here. So can you explain that, how you get into here?
So our rehab department provides physiotherapy both to inpatients, and inpatients are people that are admitted to the hospital with an acute injury, as well as to outpatients, or people that have been discharged from the hospital and need to come into the hospital for treatment and are able to get into the hospital for treatment. We actually recently partnered both with the Sunset Country Family Health Team. Oh yeah, that's the Patterson Clinic over there? Patterson Clinic, yeah. And the WinHack, our
What's
Kenora.
That?
That's our Kenora Health Access Center for our Indigenous population.
So what does WN, the acronym, stand for? WNHAC?
Well,
you don't know?
I do, but I hope I pronounce it right.
Okay.
Washa Gizik Nagandawing.
Okay.
And I apologize if I didn't.
That's okay. If they did that, yes, to them.
Pronounce that exactly correct.
And are they the only ones that can use this part then?
No. It's available to any person of
it's not just limited.
Any OHIP, anybody with an OHIP card can absolutely participate in our programs. Yeah.
So when you come here for any of these physiotherapy things, be sure and bring your OHIP card. That's one thing you surely should have. Yes.
Yeah. Need to have an OHIP card. Yes. Absolutely.
Oh yeah. I do see this where it's available to everybody in the region. So let's go on now to another question. And this is interesting. How can seniors access the right physiotherapy service for them? Like how do they know, and how do you know what is the right service for that person that comes in here? Let's just start with someone that's had a stroke, and I hear there's a right side that can be involved or a left side. So do you have to decide which side first, and then tell me about it?
No, absolutely not. Well, a good place to start for any healthcare needs is 211. And you can either go to 211.ca if you're on the computer, or just call 211. And 211
on the phone?
Yeah, it's a central information hub that helps people find the community service that they need. For instance, if they were wondering where they would go for physiotherapy, you can call 211 and they will help you find where best to go. Okay. Now, for instance, if you needed home care, you would call the home care office or have your doctor or nurse refer you to home care, and then the home care coordinator would assess you. And if they feel that physiotherapy is required, then physiotherapy would be provided.
Was that in the phone book? I mean, I like to interrupt because it would be important when this is filming, eh? So is the home care office, do you look on the telephone yellow pages under home care, or alphabetically under home care? Like how would people watching this show get it if they want to get to the home care office? Do you know the number offhand?
I do not.
Oh, okay.
Actually, you would just look online, under the Local Health Integration Network, or the LIN, is now the Home and Community Care Provider. So that's who you'd contact. So if you look up LIN 14, Home and Community Care,
so that'll get you. Yeah. And I also see that really to do that call directly like that, you don't need your doctor's permission. You don't need a nurse practitioner referral in order to get in touch with these people.
For home care, you do, but for the Kenora Sports Injury Center,
that's this.
Nope, that would be in the rec center. Yeah, at the rec center, the private non-OHIP clinic. You can call them directly, or you can even book an appointment online. They don't need a referral. They have what we call direct access. Now, as opposed to the hospital, we're subject to what's called the Public Hospital Act, and we do require a referral from a primary care provider, which is either a doctor or a nurse practitioner. Okay. So once someone sees their doctor or nurse practitioner, they can get a referral and then call us, and we'll book an appointment.
Okay. Well, what if somebody just falls at home and their back hurts? So do they have to first phone the doctor or nurse practitioner, or can they phone here, the number that we're going to give here, and and get an appointment?
So
am I making myself clear? Because I'm just wondering if somebody falls and, you know.
So if somebody falls at home, first of all, they should probably see their doctor or nurse practitioner just to make sure that they haven't sustained a significant injury. But if someone has an injury, they can get directly into the sports clinic without a referral. But again, if they want to come to the hospital or go to home care, they probably should go through their doctor or nurse practitioner first, just to make sure that that the referral is appropriate, and then the doctor or nurse practitioner can help determine should they be going through home care, should they be coming to the hospital, and can help send them in the right direction.
Now, on that topic, this is another thing I want to say. Like, supposing someone like there's 82 and they fall and they just kind of hurt their back a little bit. Well, sometimes you must know what older people are like. They think they're going to get better in 2 days, so they're going to put up with it. Maybe put the hot water bottle on their back or something. Like, is that a good idea? Should they really, if they hurt their back and they're trying to get up, should they phone their nurse or doctor, or should they wait a couple? Because they just don't like bothering people. Old people don't like bothering people.
And that's a difficult question to answer. It depends on how. It depends on the individual person. Someone who's osteoporotic, has very thin bones, may have sustained a more significant injury, should absolutely be consulting with their doctor or their nurse practitioner. So
it is important then?
It would be very important, yes.
Well, I hope we cleared that up, because that was bothering me, because I know, like, a lot of old people, I think I can stick it out, and they really shouldn't do that if it's excruciating.
No, if they've hurt themselves, they should definitely consult with somebody.
Take advantage of the services we offer,
Yes.
Okay. Now, so we're kind of on that subject anyways here. So is there a lot of concern about seniors falling nowadays? And how can physiotherapy help prevent falls in seniors?
Well, falling is really a combination of factors usually, and these may include environmental hazards such as loose throw rugs on the floor, poor or ill-fitting shoes, poor vision, medication and some medication interactions, poor nutrition, and loss of strength and range of motion. And that's where physiotherapists come in, because we can really help seniors by, indirectly referring them on to the most appropriate care provider if it's something to do with their nutrition or vision, but directly by helping them improve their range of motion and their strength, to really help improve their overall general mobility and function. And so that's really where we come in, is once we help a senior address their range of motion or strength issues, after that we would help them get into a maintenance program such as the fall prevention program that's offered by the VON at many of our locations around town.
Okay. Can I interrupt? And I'm in that program Monday, Wednesdays, and Fridays at the First Baptist Church. And I can honestly say I fell once right in the corner of Main Street in the avenue there. Fell down, and of course everybody knows me, and I was more embarrassed than anything. But because of that program, I fell the right way, and all I did was get a little bump on this knee. And of course everybody's opening their truck and car. You okay, Ruth? I was more embarrassed than hurt, But I thank that program. That's the VON. That's the one. Yes. So I can swear to how exercise is good for you. But I want to go back to something you mentioned. So I see in here that there's a lot of them have loose throw rugs by their bed. And I guess if they get out, say they have to void in the middle of the night, which many of us old people do, then that rug, and they're just in their bare feet, they should get rid of that rug. Is that right?
Well, if it's a tripping hazard, certainly if they're prone to catching their feet, if it can lift, so that's a very common one, is people do tend to have a lot of rugs on the floor that can be something that their feet can get caught in, and they could trip. Again, there's a lot of environmental hazards that should be addressed.
Can you name a few that would be?
Sure.
Name a few here for the people. Clutter.
Clutter, just having a cluttered environment, having
like books piled on the floor or something,
or
magazines,
on the floor, things like that. Things that are lying on the floor. Coffee table that is in the traffic zone. Something that's a barrier between them and getting to the washroom in the middle of the night. Things like that.
Oh, right. Yeah. See, I never thought of things. This is a good program. I know how to fall, but I didn't know a lot of other things that you're telling me.
Quite often it's just really cleaning up and streamlining the area, so as people get older there's less chance for them to get caught up in things and fall.
And another thing I'm thinking of too, then a lot of them I've noticed, like I used to go with my job to a lot of older people's places if they had an 80th, 90th, 100th birthday, and they're in really big sloppy slippers and they're so that might not be a good idea. They should maybe have something with a grip on the bottom. I think you can buy kind of slippers, nice warm slippers now with suction or grip or something on it.
That's absolutely one that we identify as poor or ill-fitting footwear, including the slip-on slippers, are often something that will cause people to fall.
Well, this has been really helpful to me. So, not only has the VON helped me to know how to fall, so I want to ask you also about care providers. Now, such as a registered dietitian for nutritional account. Now, you did mention nutrition a little while back. So, is there nutritional counseling actually available that someone can go to somebody's house and tell them what to eat and how to eat it?
Yes, actually there is. We have dietitians in our community, registered dietitians that are a fabulous source of information for people that need nutritional counseling. So if it's identified that can be like a senior is not getting proper nutrition, that can lead to potential for falling because they don't have the strength. They may be causing just general functional issues that they would need to address by getting better nutrition.
So I never even thought of that. I do know a lot of seniors, especially if they have Meals on Wheels come for noon, then for supper they might just have a piece of toast and tea. So that's probably not very good, is it?
No, if they're not getting proper, because you can have, they might be getting their calories, but they may not be getting the proper nutrition. And so getting the proper nutrition, that'll keep their bones strong, keep their, their muscles strong, that they can function
very
well.
Good. I'm sure. Now, seniors at risk. Is there a certain age, or is it any age? Like you could even fall and really hurt yourself and need physiotherapy when you're a teenager, or say even a 6 or 7 year old. You need physiotherapy. Not just. I mean, this is geared to seniors, but all these things that you're telling me pertains to everybody, really. But more concerning for seniors. Am I correct?
Yes, absolutely. It applies to everybody, but certainly as people age, your balance reactions tend to become impaired. You lose strength as you age. You lose range of motion, and so as those things happen, your potential for falling becomes
like critical,
higher.
Or? Okay. Yeah. Well, let's do non-road. I've got a note here that says a lot of seniors suffer from arthritis. Can physiotherapy help them? I never even thought about that. I never associated arthritis with. Do you want to talk a little bit about that?
Sure, absolutely. So chronic diseases such as degenerative joint disease or what's commonly called osteoarthritis.
I've heard of that.
Yeah, so that's what's referred to almost as the arthritis of aging. They're often thought to be unmanageable, but that's just not the case. We're finding now that seniors lose joint range of motion and muscular strength with a chronic disease like osteoarthritis, and what we're seeing is with proper stretching and strengthening, and with being involved in a program and just being educated about their arthritis, that seniors can dramatically improve their overall functioning. So
does exercise come in this case too?
Absolutely. Okay. So that's where a physiotherapist would be involved, is in helping a senior improve their range of motion, their strength. And it's, in fact, we have a program that we recently launched called GLAD, which stands for Good Living with Arthritis in Denmark.
Oh, it's not the plastic wrap.
No, it's a program that was started in Europe and actually has been adopted now in Canada. And we have trained our physiotherapists, and they're providing the GLAD program here, and we've had amazing results to date with people that have had very good outcomes in terms of improving their overall function, their range of motion, and their strength. We can't get rid of the arthritis, but we can help people manage much better their arthritis.
Okay. Well, I think our time's just about up. So I think you wanted to surprise our viewing audience with having me do something.
Well, we were talking about what's the best thing that a senior can do at home, and the best thing they can do at home is to just stay active. Being active is all the research shows that that's the best thing for your social, your physical, and your mental well-being. So, and the best type of activity is anti-gravity or strengthening the muscle groups that help you fight against gravity so that you can remain upright and strong. So there's some really simple exercises that people can do. So if you're at home, get off your couch.
Okay, me?
Join us. Yeah, you too.
Time for me.
So a really simple exercise.
Should I take this off?
No, it's so simple you don't even need to do that.
I'm getting kind of warm in here, so I'm going to take it off.
Sure.
I'll just throw it here.
And it can be as simple as just holding onto the back of your chair,
okay.
and simply just holding on if you need for balance, and simply just doing a squat. Just a squat like that. And
I can't do that, so I'm going to just...
If you don't need to hold on, then great. Some people, if they haven't actually done the strengthening of their legs, and that's probably because you're involved in that falls prevention, you probably do a lot of squats and strengthening. So that's a great exercise that anybody can do at home. You can do it at home right now if you're sitting on your couch.
Oh, when you get up off the couch and to squat?
Get up off the couch, just even sit and stand from the couch 10 times if you're watching TV, every hour. Sit and stand 10 times. You still can watch TV while you're doing it. You can watch TV while you're doing it. So
it's a good idea for me. I'm doing it this way. Is there some way I should put my hands, or does it matter?
That's fine. And if people can't do this, or they can't do it without having pain, they should definitely see their physician or their nurse practitioner to get a referral to a physiotherapist, or go to the clinic where they don't need a referral to start getting the physiotherapist to help them do the appropriate strengthening so that they can do this, because everybody should be able to do this.
Well, I'm telling the TV, if I can do it, you can do it out there in Kenora land. Is there another?
One other simple one is just going up and down on your toes. Holding on and just up and down on your toes, because that strengthens the big anti-gravity calf muscles. So you really want to strengthen the muscles at the front of the thigh and the back of the calf to just help you against gravity. And that's a very simple exercise, just going up and down.
I'm going to have to touch this chair. If I was in running shoes or something, I think I'd be okay doing this without touching it. But I think it would be better if you didn't have to touch the chair, right?
Well, for anyone who's not used to doing this, probably a good idea to just kind of hold on to a chair for balance. We don't want anybody falling at home. But these are some very simple, basic exercises that everybody can do just to start their anti-gravity strengthening. And again, if they're having any problems, if it hurts, if they can't do it, probably an indication that they should be seeing a physiotherapist to help them gain the strength back that they've lost.
Okay, now, do you want to sit down? I want to tell you something. You can make me do two exercises. So anyway, is there a proper way? Oh, well, thank you. Oh, that's because I bet you never heard me a word. I lost my mic. Yeah. Did you notice that on the floor all this time?
No, I just fell out.
Oh, okay. What was I going to say? No. Oh, is there a proper way to get up and out of a chair for anybody, especially seniors?
Well, it's kind of like we teach in the introduction to skiing, nose over your toes. If you've got your nose behind your toes, you're not going to be able to stand up. You basically have to have your body weight forward of your legs in order to stand.
Like this? Is that okay, or is I doing it wrong?
That's exactly it. So people that are scared of falling because they're scared they're going to fall, they'll often try to stand up without committing and putting themselves forward. By the same token, if they are at risk of falling and feel like they're going to fall, then that's when they should be seeing their doctor or their nurse practitioner to get a referral and see a physiotherapist.
Well, they're not hard exercises. They're very simple exercises, but they're so basic. And yet, I did read somewhere a few months ago that, and you can prove me right or wrong if I read correctly, that squatting is one of the best exercises a person can do. Is that correct? Do you agree with that?
Absolutely. Anything that's really strengthens those muscles against gravity, and squatting does that. It's one of the most functional things you can do, and where we see people often fall is in sitting or in standing. So absolutely. And the other thing is walking. Walking is simple. Everybody can do it. It helps strengthen your bones. And as people age, they do tend to have thinner bones. Walking is one of the best ways to strengthen your bones, and everybody can do it. You don't need any special equipment.
It doesn't cost anything. That's right. We both said the same thing at the same time.
Everybody can do it.
Yeah. Well, I think I've gained a lot of things. There was a few other things I might have liked to have asked you, but I think we pretty well covered everything. As you said already, stay active. Seniors should stay active, and
that's the best thing people can do is stay active, and it helps with everything.
And I don't like to really plug our New Horizons Senior Center, but boy, there's a lot for them to do down there, and there's teas they can go to, and there's lunches and movie breakfasts, and just sitting around with other seniors chit-chatting the gossip of the day and everything. So things like that would get them out of the house.
Absolutely.
Well, anyway, Brock, I'd like to thank you so much, because I know my listening audience is, if not only for the 55s plus, but for everyone, is definitely going to get some out of this pertinent information that you have given me here today. And I've really enjoyed chatting with you. I've learned a lot. I always learn a lot in these sessions because there's so much I realize I don't know. Anyways, I'm Ruth Bowick, and this was Brock Chisholm, and I shall return with another educational segment for Health 55 plus. Thank you.